Good afternoon, and thank you for attending today's webinar. Today we'll be sharing an update on in-home aged care. To get us started, I would like to begin by acknowledging the traditional custodians of the lands on which we are virtually meeting today. I'm based in Canberra on the lands of the Ngunnawal people, and I recognise any other people or families with connections to the lands of the ACT region. I wish to acknowledge and respect their continuing culture and the contribution they make to the life of this city and region. I'd also like to extend that acknowledgement out to any other Aboriginal or Torres Strait Islander people who may be attending today's event. I'm Erika Barnett. I'm the Acting Assistant Secretary of the Assessment and Home Care Transition Branch at the Department of Health and Aged Care. I'm joined today by a few speakers. So Julie Atkinson, who's the Acting Assistant Secretary of the Single Assessment System Branch, Katherine Koesasi, who's a Director in the Single Assessment System Branch, Rowena, Sierant, Director of the Assistive Technology and Home Modification Scheme in the Supported Home Reform Branch, Michelle Smith, who's a Director in the Assessment and Home Care Transition Branch, and Biravena Kumarakuru, who's a Supported Home Change Manager in the Assessment and Home Care Transition Branch. Jasmine Snow, who's the Acting Assistant Secretary of the Supported Home Reform Branch, will also be joining us as a panellist in the question and answer session later today. We are recording today's webinar, so it can be shared for those that are unable to join us today. It will be available in the department's website in the coming days. To access the webinar slides, you can scan the QR code or go to the website link listed on the screen. There's no option for attendees to turn on their video or microphone today. However, you can lodge questions in the Slido box on the right-hand side of your screen. We will attempt to respond to as many questions as possible at the end of the webinar today during our question and answer session, but any questions outstanding will be answered in a new frequently asked questions resource after the webinar. Questions submitted during the registration process have also been considered for the Q&A session. We have updates from a few areas across in-home care, in-home aged care today. So today we'll be providing an update on the single assessment system workforce, the assistive technology and home modification scheme as part of supported home, and the steps that providers need to take to transition to the supported home program from 1 July 2025. Before I hand over to our speakers, I'd just like to briefly address some of the recent ministerial announcements we've had in the past few weeks. On the 18th of November, the Minister for Aged Care, that's Minister Wells, announced the establishment of the Aged Care Transition Task Force. The task force is going to be working collaboratively with the department to guide the aged care sector to transition to the new Aged Care Act, which comes into effect on 1 July 2025. They'll be working to identify and address any implementation issues and provide expert advice to the Minister and the department during transition. The Transition Task Force has oversight of a few key implementation areas that you can read there on the screen. And the members on this task force have a range of expertise in relevant aspects of the aged care system, so including people receiving care, approved providers, people who are in the workforce, regulation, expertise in service delivery, education and training, data and digital components of the system, clinical care and primary care as well. Our first meeting was held last week on the 28th of November, and it was very productive and very insightful, and we look forward to the next meeting later this month. A couple of other announcements. On the 19th of November, Minister Wells announced that there will be changes to the supported home everyday living service caps, along with a grant opportunity to assist providers with IT changes. So that's the proposed caps for cleaning and gardening of 52 hours per year, and gardening services of 18 hours per year have been removed. This means there'll be no limits on the hours of gardening and cleaning services that eligible participants can receive under the supported home program within their package. The department has also committed to developing a grant to help providers with the cost of developing IT systems needed to implement the reforms. Eligible providers will be able to apply for up to $10,000 as a contribution towards their IT costs for making changes to prepare for 1 July. Still currently working through the arrangements for that grant, and they'll be published soon. All right, so let's get into our speakers. I'd like to introduce again Julia Atkinson and Katherine Koesasi from the Single Assessment System Branch to give us an update on the Single Assessment System.
Thanks, Erika. I kicked off by not unmuting myself, so that bodes well. Hi, everyone. Good afternoon. As you've heard, my name's Julia. I'm the Acting Assistant Secretary of what used to be called the Aged Care Assessments Branch, but is now called the Single Assessment System Branch. And I'm joined by Katherine Koesasi. Katherine is our Policy Director. So today we're going to give you an update on the Single Assessment System. Today we'll cover a bit of a brief overview on what we mean by the Single Assessment System. We'll also provide a brief overview of the key changes for older people, assessors, home care providers under this Single Assessment System workforce. And we'll be giving you a high-level overview of the key dates and where you can go for further information. Okay, so a single assessment system for aged care. We're establishing a single assessment system to make it easier for older people to enter aged care and to access different services as their needs change over time. The system as a whole has three distinct components. The first is the integrated assessment tool. Integrated assessment tool rolled out on the 1st of July 2024, and it replaced what was used to be used, which was the National Screening and Assessment Form. Integrated assessment tool is the form, the tool, the set of instruments that the assessors use to guide their assessment of older people. And a lot of research was put into improving that resource so that we could have more consistent and accurate assessments for older people. The second component is the Single Assessment System workforce. This will be ready to commence services by next week. And from July 2025, we will also be progressively introducing First Nations assessment organisations. These are to provide a bespoke, culturally safe pathway for older Aboriginal and Torres Strait Islander people on top of the pathways available through the broader Single Assessment System. Okay, so how did we get here? 2021, we had a Royal Commission into Aged Care Quality and Safety inquiring into the quality of aged care services in Australia and whether those services were meeting the needs of the community and how we could improve those services in the future. And the Royal Commission found that in the assessment space, what we were seeing was older people being passed between assessors and assessment organisations as their needs changed. And this was resulting in a lot of poor outcomes for older people in that part of the system, including really inconsistent assessments in some cases, inefficient delivery of services for assessment organisations who were doing their best but working within an inefficient framework, quite a complex system for older people to navigate and their families, and also a degree of duplication as different assessment organisations trying to help the same person, often doing or repeating tasks. So the Single Assessment System has specifically been established in response to Recommendation 28 coming out of the Royal Commission into Aged Care Quality and Safety. And the Royal Commission recommended that we establish this single assessment workforce and that the workforce be empowered and trained to do all of the assessments that are needed across home and residential care. Okay, so the single assessment system will make it easier for older people to access aged care and to adapt their services as their needs change. Key elements of the new system include creating a single pathway for older people through their aged care assessment, supporting older people to not have to repeat their story multiple times, ensuring access to assessments in regional, remote and rural areas, and this is something that the system does now, but we want to confirm that we will continue to do that and improve that access over time. We also have a very sharp goal of reducing wait times for access to aged care assessments for older people. And the government is aware that we have long wait times in some areas, particularly for comprehensive assessments for home care packages. So one of our goals in the single assessment system is to address that issue. Okay, so as I mentioned earlier, the Integrated Assessment Tool, or IAT, was introduced in July 2024. It provides the foundation for the single assessment system reforms. And the IAT has been developed and designed to help enable changes that will be introduced iteratively or over time. And these changes include this switch to a single assessment workforce starting from next week. We are also introducing clinical attendance arrangements to support the single assessment workforce. And this is about making sure that we've got that clinical attendance and clinical oversight when it's needed, but that we're able to be flexible and responsive in the way that we deliver that clinical oversight and attendance. We've also introduced a new triage delegate role, and we're introducing an IAT algorithm to support consistent outcomes for clients by confirming their assessment pathways and support needs, or support their assessment pathways and assessment outcomes, support and match their needs. To be clear, it's an algorithm that we're hoping will support the decision-making process that assessors will undertake, but assessors will be the key person helping guide that process as the expert, and they'll be required to do that in collaboration with the client, the older person. So building on that overview that I've just given, the next section of the presentation just provides a little bit more detail about the single assessment workforce. So what is it? What is the single assessment workforce? So as I said, from next week, Monday, 9th of December, we will be switching into new contractual arrangements with assessment providers. And under those arrangements, we'll be setting up a system in which aged care assessment organisations will be funded to deliver aged care needs assessments and/or residential aged care funding assessments. So aged care needs assessments, these organisations delivering these, they will have a mix of both clinical and non-clinical assessment staff. Aged care needs assessments essentially is a new term that we're using to replace old terminology we used to call ACAT and RAS organisations. Aged care needs assessment organisations will be doing both clinical and non-clinical, or as you might otherwise call them, home support assessments, which result in approvals for Commonwealth Home Support Program, and comprehensive assessments, and these can result in approvals for home care packages, flexible care aged care programs, residential respite or residential permanent entry. And so that is the new arrangement. There won't be just one organisation can only do CHSP approvals and nothing else. Under the new arrangement, those needs assessment organisations will be doing that whole scope. Under the new arrangements, some assessment organisations will also be conducting residential aged care funding assessments. And for those who are familiar with that system, they'll know those as ANAC assessments. So not all assessment organisations will be required to deliver ANAC assessments, but some will, and some will deliver ANAC assessments or aged care funding assessments and needs assessments. So to get into a little bit more detail on all of that, I'm going to welcome Katherine Koesasi to tell us a bit more about what the single assessment system workforce is. Over to you, Katherine.
Thanks, Julia. Okay, good afternoon, everyone. As mentioned earlier, my name is Katherine Koesasi and I'm one of the directors in the Single Assessment System branch. So the Single Assessment System workforce refers to the aged care assessment workforce, which from December 2024, so this month, will bring together assessors from the Regional Assessment Service, or RAS, aged care assessment teams, or ACATs, and the Australian National Aged Care Classification, so ANAC. State and territory governments will continue to deliver aged care needs assessments as part of the single assessment system, and they'll retain 100% of in-hospital assessments. So the single assessment system will replace the Regional Assessment Service, so RAS, used for the Commonwealth Home Support Program, aged care assessment teams, so ACATs, which were used for the Home Care Packages Program, the Short-Term Restorative Care Program, the Transition Care Program, residential respite, and entry into residential aged care. And the Independent Australian National Aged Care Classification, so ANAC assessors, used for residential aged care funding. Following an open tender process, 17 organisations were awarded contracts to deliver the single assessment system. This is in addition to the state and territory governments who retain a central role. So 8 of the organisations will be delivering both aged care needs and residential aged care funding assessments. 7 organisations will be delivering aged care needs assessments only, and 2 organisations will be delivering residential aged care funding assessments only. Assessment organisations will be aligned to service areas, which are mapped to aged care planning regions, or ACPRs, as you can see on the screen. There will be 22 service areas under the single assessment system, and each service area will map up into an ACPR. This diagram provides a visual summary of what we've spoken about so far today. If we focus on the single assessment system flow on the right-hand side, it highlights the single assessment pathway, with an older person being assessed by an assessment organisation that conducts both aged care needs assessments and residential aged care funding assessments, with the combined workforce of clinical and non-clinical assessors. When support at home begins on 1 July 2025, the single assessment system for aged care will already be in place to assess older people for the program. For this to operate smoothly, several key changes are required as part of the single assessment system workforce. For older people, there will not be many changes in the introduction of the single assessment system workforce. For example, assessments will continue to be done in person, at their own home or in hospital if required. There will be no changes to aged care eligibility requirements. There will be no changes to the processes for applying for an assessment with My Aged Care, referrals to urgent services, in-hospital assessments, residential aged care funding assessments, or reassessments. The single assessment system is flexible and will adapt to the changing needs of older people without having to change assessment organisations. During assessment, older people will be supported by the same assessment organisation, even if they identify a change of needs. There are a couple of points where older people may notice changes, however, and they include: if an older person is having a home support assessment by a non-clinical assessor, that assessor can call a clinical assessor by phone or video conference to discuss questions that require clinical judgment. If a clinical assessor is not available right away, they will call back or arrange a follow-up assessment to ask the remaining clinical questions. If an older person is having a comprehensive assessment by a clinical assessor, they can change to a home support assessment if required. For the assessment workforce, this phase of the single assessment system will bring together assessors into one workforce, known as the single assessment system workforce. There will be a simplification of terminology under the single assessment system workforce. For example, all references to ACAT, RAS, Assessment Management Organisations or AMO, ANAC or RFA organisations will be removed and replaced with assessment organisation. The term aged care assessor will be used to describe individuals who conduct aged care assessments, including both aged care needs assessors and residential aged care funding assessors. Aged care needs assessor is the term that will be used to describe clinical aged care needs assessors and non-clinical aged care needs assessors who are completing aged care needs assessments. Residential aged care, or RAC, funding assessor is the term that will be used to describe an assessor who is completing a RAC funding assessment using the ANAC assessment tool. For aged care needs assessors, clinical attendants will be introduced to support assessors where needed. And assessors will be provided with access to training aligned to their clinical qualifications to support them to successfully transition to the single assessment system. For home care providers, some of the changes you might notice include changes to contacts for assessment organisations in some geographical areas. We'll publish a searchable map shortly, which will make it easy for you to see the organisations operating in your area. We're introducing clinically qualified staff into triage roles who will undertake a short triage process as soon as possible once they've received referrals for an aged care needs assessment. These clinically qualified staff have the experience and expertise to assess and determine the needs of an older person. This will ensure older people with lower needs are not over-assessed and those with complex needs have access to a comprehensive assessment. The process for referrals will remain the same. Okay, in this next section, milestones within the single assessment system. The first key milestone within the single assessment system was the release of the new IAT, which occurred on the 1st of July this year. The single assessment system workforce will commence services from 9 December 2024. Over the weekend of the 7th and 8th of December 2024, there will be some updates to the My Aged Care Assessor portal and also to the Aged Care Assessor app to get ready for Monday 9 December. Private organisations will ramp up their clinical assessment capacity from the cutover weekend. And from the 1st of July 2025, we will be progressively introducing new First Nations assessment organisations. Okay, I'm now handing back to Julia to talk to you about some further information.
Thanks, Katherine. Okay, so just to wrap up our section on the single assessment system for today, you can find more information about these reforms by accessing the QR code that's shown on the slide there. We will be updating our website on Monday, the 9th of December, and this will include some useful resources, including a fact sheet for older people to help them understand what these reforms mean to them. We will also be publishing a refreshed searchable map where you'll be able to find details of the assessment organisations operating in your area, either by browsing around the map or by entering your home address. You can also find more useful information on the assessment process on the My Aged Care website. And that concludes this section of the presentation. Thank you very much for listening, and I'll pass back to Erika.
Thanks, Julia. Thanks, Katherine. So I can see quite a few questions coming in on single assessment already, but just a reminder to people to pop those questions into Slido, and we'll look to those at the end of the presentations. I'd now like to move on to the supported home program and introduce Rowena Sierant, who's going to discuss the assistive technology and home modification scheme. Thanks, Rowena.
Thank you, Erika, and good afternoon, everyone. My name is Rowena Sierant. I'm one of the directors in the Support at Home Reform branch, and today I'll be sharing with you an update on the Assistive Technology and Home Modification Scheme, or ATHM scheme as we like to call it. I'll give you an update on the scheme, the ATHM list, and the AT loan scheme and the loan scheme trial that we are currently conducting. As just a brief overview, the ATHM scheme is being introduced as an integral part of the broader Support at Home program. The scheme will provide upfront access to equipment, products and home modifications with separate funding to the ongoing services that will be available under Support at Home. Following an aged care assessment, eligible participants will be able to access products, equipment and home modifications without having to save their funds from their budget as they do now under home care packages. These supports will help reduce the risk of falls and other injuries for older people in their homes, enabling them to age in place and delay or avoid entry into residential aged care. Support at Home providers will manage and deliver the Support at Home participants' ongoing budget and services, as well as their ATHM scheme funding. And they can engage a third provider to deliver these services, but will remain responsible for the quality and safety of those services in those cases. Under the ATHM scheme, there will be 3 funding tiers for AT funding and a further 3 funding tiers for home modifications. A participant will be allocated a low, medium or high funding tier based on their assessed needs through the single assessment process that Julia and Katherine has just spoken about. If assessed and approved for both assistive technology and home modifications, the amounts are additive, so participants can receive both allocations at the same time. The assistive technology and home modifications funding will cover prescription where it's required, the product or equipment that the participant needs, and any wraparound services to ensure safe use of these products and equipment in the person's home. If a participant's ATHM needs change, they can seek reassessment of their assistive technology and home modifications funding tier through a support plan review, and there is no limit to how many times this can occur over a 12-month period. The final funding tiers will be confirmed when support at home starts from the 1st of July 2025. An integral part of the ATHM scheme is the ATHM list, and that will outline the products, equipment and home modifications that support at home participants can access through the scheme. The list was developed using the Australian Adopted Assistive Product Classification and Terminology Standard and draws from internationally agreed instruments such as the Convention on the Rights of Persons with Disability. The ATHM list has also been informed by subject matter experts and broader sector consultation over previous months. You will be able to access the full ATHM list via the department's website shortly. We are hoping that that will be available within the week up on the department's website. The ATHM list defines what products are available under the scheme, and it groups these into categories for products and equipment. The groups will be for assistive technology, managing bodily functions, self-care, mobility, domestic life, and communication and information management. And for home modifications, there is a section that is specific to home modifications. This is an example of what one part of the list looks like. Here we have the proposed example from managing bodily functions. As you can see, it outlines the items that can be provided under that category, as well as providing guidance on whether the item requires some level of advice or prescription. As I said, we'll be publishing the full list shortly on the department's website. So how does it work? Well, all assistive technology and home modifications on the ATHM list are categorised in terms of the level or skill or qualification that is needed to provide recommendations for the safe and effective use of the product, equipment or home modification. And these supports are broken into 3 categories. There will be those that are low risk, and this is for simple and relatively low cost daily living products, usually available off the shelf. And they don't need clinical assessment to select the items. There will be under advice category, and this is for assistive products that are generally accessible but would benefit from some level of written or professional advice to ensure that they are selected, installed or used effectively. And then there will be those items in the prescribed category. This is for more complex and often more costly products or combinations of products that are configured, personalised and or adapted precisely to meet an individual's support needs and home modifications. The department will be providing advice on proposed prescribers who can assist in this part of the process, and that will include occupational therapists, physiotherapists, rehabilitation therapists, social workers, nurse practitioners, dietitians and nutritionists, Aboriginal and Torres Strait Islander health practitioner and workers, counsellors and psychotherapists, and sometimes medical practitioners where that is applicable. Home modifications will be accessible by prescription only. As part of the ATHM scheme, a National Assistive Technology Loan Scheme will be delivered. And this is really to support a sustainable equipment model and address a lot of the feedback that came through in the Royal Commission. The AT loan scheme is anticipated to commence from July 2025 with a staged rollout across the country. Clients assessed as requiring medium to high cost assistive technology will be able to access these pieces of technology through the loan scheme. Home modifications will not be available through the loan scheme in the first instance. It is expected that eligible equipment for the loan scheme will be defined and identified in the ATHM list. And it is also expected that the scheme will leverage existing state and territory programs to support the provision and setup of suitable loaned equipment, as well as repairs and collection of equipment when it is no longer needed. Participants will also be able to swap equipment in and out of the loan scheme where it's required to manage their changing needs over time. This will be particularly beneficial for older people with progressive conditions. The AT loans list will include standard, medium to high cost risk items that can be reused. These items will require prescription for appropriate allied health professionals to ensure the appropriateness of the assistive technology and support the older person to live safely in their home. And this slide gives you a representation of some of the pieces of technology that we expect would be available through the AT loan scheme. To help us to understand the design of the AT loan scheme, the government has funded a trial. This trial is currently being run by Enable New South Wales through their existing aids and equipment program and is underway in 2 locations, one in the Southwest Sydney Aged Care Planning region and one in the Murray-Riverina region. And these locations were chosen deliberately to test the scheme in an urban location with a diverse population alongside a regional area with a large geographic spread of population. The trial began on the 29th of July this year and will run for approximately 12 months. The purpose of the loans trial is to test key aspects of the loan scheme, including the prescription framework and how wraparound services would work. What are the appropriate pathways? In particular, do they differ between metropolitan and regional areas? An understanding of the compliance to relevant code of ethics and quality standards and guidelines. And for us to actually understand what the reuse of equipment, warehousing and storage needs would be of the scheme on an ongoing basis. I will now take you through the prescriber and client eligibility for the AT loans trial currently underway. As I said, the trial sites are in the Riverina Murray area and the Southwest Sydney area, and people must reside in one of those 2 areas. They must be permanently living. They must not be permanently living in a residential aged care facility. Eligible prescribers will include health professionals who prescribe equipment for communication, mobility and self-care. And eligible clients will include those who have been assessed and approved for a home care package or a short-term restorative care package. CHSP clients are not eligible for this trial. The Metropolitan and Regional Aged Care Planning region was selected to help shape the scheme. The list of items available in the trial was reviewed and refined in line with current prescription trends, items that would meet most participants' needs, and items that can be refurbished and loaned. So it doesn't cover the entire ATHM list, but has been deliberately selected to include those items that lend themselves to being loaned. We are conducting a formal independent evaluation of the trial, and that information will be used to finalise the design of the trial of the scheme as we go forward. That concludes my presentation. Thank you for listening, and I'll hand you back to Erika.
Thanks, Rowena. I can see a lot of home mods questions coming in too and assistive tech, so that's great. Keep popping those in and we'll get to them at the end. So just going to go into our last presentation for today. So welcoming Michelle Smith and Biravena Kumarakuru from the Assessment and Home Care Transition Branch to present to you some change and transition readiness activities ahead of the Supported Home Program launching on 1 July 2025.
Thank you, Erika, and good afternoon, everyone. My name is Michelle Smith, Director in the Assessments and Home Care Transition Branch. I'm joined by Biravena Kumarakuru, Change Manager for the Supported Home Program. Today we will be covering the readiness and transition approach we have taken for support at home, transition journey stages for providers in transitioning to support at home, what we are doing to get the sector ready for 1 July 2025, tools to support with transition activities, and the support at home transition support model. In our September webinar, we covered the support at home program design. Key changes for both providers and participants include the new support at home service list, where providers can only provide services on the service list. Participants' budget allocation will be changed to quarterly, including existing home care package care recipients transitioning to support at home. Providers will be required to provide more information when submitting invoices for services delivered. As a result, there may need to be changes made to internal processes and systems to capture the relevant information. 10% of a participant's ongoing budget will be allocated for care management services and allocated to the provider's pooled care management funds. There will be changes to participant contributions, and providers will need to understand these changes. Providers will be required to assess their workforce and skills to ensure care management services are delivered by a care partner who is appropriately trained to deliver care management services. As Rowena discussed earlier, there will be a new AT-HM list that providers will need to review to determine if they will provide AT and/or HM services under the Support at Home program. Providers will need to have processes in place to deliver these services. For example, understanding how to source AT and/or HM supports. There are 2 new short-term pathways, the restorative care pathway and the end-of-life pathway. Providers will need to decide if they will offer these services and ensure their workforce is ready to deliver these services under the Support at Home program. On the screen, you will see a snapshot of the current provider landscape, which we have assessed with feedback provided by some of you through various channels. We are targeting our readiness and support activities to all providers, regardless of size, workforce, and other resources available to them. Some of the key concerns raised with us include providers will face system transition challenges, including alignment with the changes to current HCP client financials and future support at home participants. We have heard that vendors do not have enough time and resources to meet requirements and that any dual system requirements will pose difficulties for compliance. Service providers are setting up multiple listings of their services on the My Aged Care website, as they have not been provided clear guidance or rules on how to use the system. This is in addition to technical issues with My Aged Care, with providers finding it difficult to receive support on GPMS, MAC, and/or Services Australia systems. The cost of IT elements are substantial, particularly for standalone small and/or regional providers. Workforce shortages reduce opportunities for training as workforce needs to be available for face-to-face service delivery. Training is also costly for providers. Updating organisational processes, ICT systems, staff training, and raising awareness among older people will require time, understanding, and resources, and the importance of implementing reforms in a clear and cohesive manner. I would now like to pass to Biravena to discuss what we are doing within the department and with our delivery partners in response to the feedback and to support sector readiness.
Thanks, Michelle. Hello, everyone. I'm Biravena Kumarakuru, Change Manager for the Support at Home program. Over the past couple of months, we've been working on the end-to-end changes for existing providers and clients. From this work, we've identified the actions providers need to take to be ready for support at home and deliver services from 1 July 2025. We have separated these activities into 5 stages. So the first stage is to learn about the new Support at Home program. Stage 2 is to prepare for transition. Stage 3, deliver services. Stage 4, receive payments. And Stage 5, facilitate changes in services. Stage 1 and 2 will occur before 1 July in the lead up to the Support at Home program. Stages 3 and 4 will occur post 1 July. And Stage 5 is an ongoing stage. So with stage one, so the first stage, it's learning about the new supported home program. Here, providers need to understand the new supported home program and changes they need to make to their business operations. So for example, providers need to learn about the new Aged Care Act, supported home and worker obligations, their obligations and registration requirements, which includes provider registration categories, obligations and conditions of registration, penalties under the new Aged Care Act, obligations for subcontracted or third-party providers, and worker obligations. The supported home program's financial and payment mechanisms, such as the new funding model, care management, fund administration, eligibility for supplementary grants. And the supported home program services and requirements, including the service list details, the assistive technology and home modification scheme provisions, access and delivery of restorative care pathway funding, access and delivery of end-of-life pathway funding, the assessment and waitlist process, and the interface with other programs such as the Commonwealth Health Support Program. Providers will also need to understand how supported home will impact your organisation's business model. This includes determining the services that you will offer to participants, determining the workforce requirements, including the role of the service delivery staff, workforce training requirements, education needs for the workforce to provide culturally safe, appropriate care, and to support staff undertaking end-of-life care, the obligations under the quality standards for those working for providers registered into categories 4 and 5, and understanding the supported home program financial and payment mechanisms. Finally, for stage 1, providers will need to understand their organisation's readiness for the supported home program. In preparing for transition, here providers need to understand the actions they need to take to prepare deliver services for supported home. So for example, providers will need to modify their operations in preparation for supported home. This includes communicating with transitioning home care recipients on changes such as their budget, consumer contributions, budget management, care management, funding, and the availability and obligations of self-management. Providers will also need to inform short-term restorative care clients of the changes to the restorative care pathway under the supported home program and that they may have access to the ATHM scheme. They'll also need to prepare for service delivery for participants, prepare financial and reporting systems, preparing your systems and processes to align with the new Aged Care Act regulatory model, and undertaking workforce training and readiness, ensuring your workforce has completed training on the supported home program design, restorative care pathway, end-of-life pathway, the ATHM scheme, care management responsibilities, cultural competencies, and contribution waiver systems. Providers will also need to ensure relevant care partners and service delivery staff hold relevant health qualifications. And also preparing your ICT systems in integration, such as changes to IT systems in alignment with ICT technical specification to submit itemised invoices to Services Australia and their systems to monitor each participant's quarterly budget expenditure to mitigate risks of overspend running out of funds. Also in stage 2, providers will need to register under the correct registration categories to deliver and claim for services. This includes validating registration categories assigned during the deeming process and, if required, providing additional information. Stages 3 and 4, as I mentioned, occur post 1 July 2025. Once supported home has begun, stage 3 is the start to deliver service stage. Here, providers are operationally ready and start to deliver services for supported home. So for example, implementing a new care management responsibilities, including allocating eligible participants to appropriate care management funds and services, delivering supported home services to new current HCP participants, and ensuring compliance with registration conditions and mandatory obligations under the new Aged Care Act. In stage 4, is a receiving payment stage where providers deliver services and have delivered services and are ready to receive payments. So for example, generating and issuing monthly statements for participants for services used against their care plan, submitting service claims to Services Australia, including care management funds for participants and subsidy claims for ATHM services. The final stage is the facilitate changes in service phase. This stage is ongoing and focused on ensuring providers receive notifications when there is a change in a participant's care needs or when they no longer needing to provide supported home services for a participant. For example, the transfer process if a participant was moving to another provider and understanding the processes for exiting the supported home program if needed. We will be publishing a provider transition readiness checklist, which will outline all the actions providers will need to take in each stage of the transition. We have a series of readiness activities to support you with your transition. I just spoke about the provider transition checklist, and we will be publishing this on the department's website before the end of the year. We have also developed a transition support model, which I will talk to you about shortly. We will have knowledge articles and a program manual for support at home, which is expected to be released in March 2025. We're also working with our department representatives located in each state and territory who will deliver education and support to providers on the ground in their local areas. We will be sending targeted correspondence to existing recipients around March or April to explain what the changes will mean for them. This will include what it means for their funding, participant contribution, and services. Training will also be made available for providers. We are working through our approach and developing content and will provide more information in the new year. Once we transition to the new supported home program, we will continue to support you through a dedicated support model to provide support as you start to provide services under the new supported home program. We'll also update and develop support tools based on feedback we receive and provide additional training based on your feedback. Some tools to support providers with the transition are already available on the department's website, including the Supported Home Program Handbook, which helps providers understand more about the Supported Home Program design, the Supported Home Service List, web content on the Supported Home Program, including frequently asked questions, recordings of previous webinar and Q&A sessions, and guidance for providers in their communication with older people, families, and carers. Other support activities that are currently in development and to be released iteratively include the Supported Home Program Manual, which is a detailed operational guide that will outline the policies and processes for the end-to-end delivery of support at home, technical information on the IT systems and specifications, including user guides, training modules and resources, and other web content and targeted communication. Our transition support model aims to help providers and participants effectively transition into the supported home program. For providers, we are working closely with the department's local network to support you with the transition activities. We will provide locally engaged staff in each jurisdiction with the tools to support you and be a feedback mechanism if you have any questions or concerns that you may want to raise. We will have more targeted resources and tools available on the department's website. Your feedback on whether you need more information or support resources is valuable to us. And we encourage you to provide feedback through your local network representatives or via the email listed on the screen. We will be establishing a community of practice in 2025, which will be a channel to discuss transition activities in the lead up to the supported home program going live from 1 July. Once we transition to supported home, we will use the community of practice to discuss operational inquiries. For existing HCP participants, we will be sending out letters to their registered addresses with further information that is important for them to know amidst the transition to support at home. Services Australia will also send letters about the new contribution rates next year. We will inform providers of the timing of this letter so that you have visibility of all correspondence. We will also have resources available specifically designed for older people, carers and families. We will also support providers by supplying resources to assist with conversations you need to have with your clients. Participants can also continue to leverage existing resources such as the Aged Care peak bodies and the My Aged Care Contact Centre for further support. In addition to our supported home supports, there are some existing programs already in place for aged care providers who may be interested in seeking support. The Business and Workforce Advisory Service allows eligible aged care providers to apply for a free, independent and confidential advice to improve your operations. We have engaged consulting firm EY to provide this service for eligible residential aged care and home care providers. The services are designed to assist providers to better understand challenges and opportunities affecting resourcing, viability, and profitability. Providers will receive these insights through a variety of formats, including written reports, verbal advice, interactive workshops, and deep dives with boards. You can find out more on the website on the left-hand side of the screen. The Rural, Remote and First Nations Aged Care Service Development Assistance Panel is also available. This service provides free professional support to aged care service providers who are in rural or remote areas or who provide care to a significant number of older First Nations people. Panel members can assist in provider capability and support through one-on-one assistance to review and build sustainable business and clinical practices. Sector development through various training and education programs and resources aimed at building capability within providers in regional and remote areas. Capital infrastructure project management through project management support and guidance for capital infrastructure work to ensure compliance and success. Find out more on the website on the right-hand side of the screen. That concludes our presentation. Thank you for listening. I'll now hand back over to Erika.
Thanks, Biravena. Thanks, Michelle. So before we get into our Q&A session today, I just want to highlight the next steps for the Supported Home Program. So as was mentioned earlier, we will be publishing the provider checklist and the ATHM list shortly. We're working closely with our colleagues across various areas of aged care reform to best prepare you for the upcoming changes, continuing to engage providers and peak bodies to work out how to deliver the right information to support you and your transition to the new Aged Care Act. Services Australia are due to release their IT specifications before the end of the month, and will continue to support older people, family and their carers with the transition through additional supported home resources, some targeted webinars in early 2025, as well as face-to-face sessions across the nation in 2025, focused on the broader aged care reforms. To access the existing resources on the Supported Home Program, you can scan the QR code on the right-hand side of the screen. One other thing I'd also like to draw your attention to is the Aged Care Reform Sector Pulse Survey, which is currently out. So please send us your feedback on the implementation of the reforms and your support throughout the process via the QR code on the screen there as well. That one's open until Friday, the 13th of December. Okay, so that wraps up our presentation. We're going to get into a couple of questions and answers now. Bring everyone in. Just a reminder, any questions that get left unanswered today, and there is quite a lot, and we did get quite a few before the session, they'll be addressed in an updated frequently asked questions after the session, like we've done for previous webinars. Okay. All right, so I'll probably just draw on a couple from the single assessment system questions to start, since that was our first presentation. So Julia, there's a question here just around the number of entities that will be working together as part of the single assessment system. It says the department's awarded contracts to 17 organisations. Who are the other 7? How does that work with the states, basically?
Yeah, thanks, Erika, and good question. And I think I saw the question flow through, and there was a suggestion. Oh, did one of the states are they not all participating? All of the states and territories are continuing on in the single assessment system. The numbers don't quite add up because states and territories, we've been negotiating with one-on-one, so government to government. States and territories were also eligible to participate in the tender. And some chose to. One state was successful in increasing their market share through the tender, and so they are one of the 17. And I hope that clarifies things.
That's great. Thanks, Julia. There's another one here that's, what's the future of the current ACAT teams? Will some or all of the state and territory ACATs continue in the community, or only continue to deliver hospital-based assessments?
Yeah, so another great question. So ACATs, I suppose to kind of clarify again, ACATs are of the past and a wonderful past collaboration that has been, but we'll be moving into the single assessment system as aged care assessors. State and territory governments, as I said, we've been negotiating with states and territories bilaterally, but also in one instance through the tender as well. And states and territories are going to continue to play a central role in the system. They will continue to deliver all hospital-based assessments. They will also continue to deliver a large share of community-based assessments. So future for ACAT teams, that's probably, I won't speak to in greater detail because that's an organisational question really when it comes down to it around how organisations set themselves up. But future of the participation of the states and territories in the assessment system, 100% in hospitals and also an ongoing large role in community-based assessments, yes.
That's great. Thanks, Julia. Now, I'm just going to do one more assessment one. I think this one is important. So not that any questions aren't important, but this one's important from a client point of view, I think. So what does getting an assessment look like for people needing an assessment in the transition period, i.e. people currently on the wait list for a RAS or ACAT assessment? Will they still receive that assessment, and do they retain their spot in the queue?
Yeah, fantastic question, and definitely can see how that's front of mind for those who are waiting for an assessment. So can confirm we are well aware of where there are people waiting and wait lists, and we've got a good handle on that on our systems. There's a process in place that I will not try to speak to in great detail because I'll butcher it. We've got some very smart technical people working on data transfer. And so what we're planning to do is as our organisations who are successful through the tendering process get up and running and confirm that they're ready to roll, we'll be working to do some load balancing around where those wait lists sit in line with where market shares are awarded coming out of the tender and through negotiation with states and territories. So we're not, those currently waitlisted referrals won't be lost. We've tracked them on system and they'll remain in system to be assessed in that order. But to make that happen faster at a certain point, if there's still some sitting there ready to go, we'll be splitting that up and having other organisations help participate in moving those people who are waiting through to an assessment.
That's great. Thanks, Julia. Might just move to a couple on home modifications then. So we've got one here. When a participant has reached their lifetime cap of $15,000 for high tier home modification funding, are they still able to access low and medium tier home modifications in subsequent years? I'll head to Rowena for that one, I think.
Thanks, Erika. So there's a few questions, I think, on the funding tiers and how they work. So for the home modifications, people can continue to access the low and medium home modification tiers as they need them. The assistive technology and home modification tiers, the assistive technology funding tiers work in the same way. So people can continue to access and continue to move between a low, medium or high tier if their needs change over time and as they need to. The assistive technology high tier, there was a question just about that, which I thought I would just address, has a nominal cap of $15,000, but with evidence, people can get more funding in that assistive technology high tier should they need it. So if they do need a specialised motorised wheelchair, as the question asked for, then they would be able to get that through the assistive technology high funding tier.
Thank you. There's also one that seems quite popular. I'm just pulling out here. So how will people be expected to pay the excess on their $15,000 cap? So the example given is changing a shower over a bath arrangement, for example, can be very expensive, especially in rural and remote areas. So how does that get handled in the model?
Yeah, so there's a couple of elements to that. One is that we do have additional supplements that are available for people in regional and remote areas for both assistive technology and home modifications to address the issues of being able to actually get both assistive technology and home modifications in those areas. And so that will be available to people in those areas as they need it. We acknowledge that $15,000 will not necessarily cover every home modification that somebody would like to have or needs to have to their home. And it's really about the Commonwealth contribution to the home modification that the home modification scheme will cover.
Great, thank you. Another one here about maintenance. If an item of equipment requires ongoing or periodic maintenance, will ATHM have an annual budget allocation for those costs?
So there's a couple of different ways that we think that maintenance will work. In the loan scheme, if you have loaned equipment, the loan scheme will cover the repairs and maintenance that you actually need on the loaned item. And that could actually be through taking it back and swapping it out or having those repairs done in the home, depending on the repair that is required and the particular situation. For assistive technology that has been purchased, you can continue to use your assistive technology funding tier for those repairs as needed. And there will also be the capacity for people to access their support at home classification level funding to be able to cover repairs and maintenance if they have that available to them.
That's great. And maybe just one more from here, and then we'll do a few supported home ones. So broader supported home. So who coordinates ATHM? And if so, how will the coordination be funded?
So support at home will be rolled out with a single provider model in the first instance. And so it's the expectation that the participant would work with their registered support at home provider to understand what their assistive technology and home modifications need, and that it would be the provider that would source any low cost or low risk assistive technology that doesn't need prescription, and that would organise the prescription where that is required.
Thanks, Rowena. All right, let's get into some broader supported home ones. So Jasmine, I might go to you for this one. There's a couple of questions just asking for an update on pricing and costings. Would you be able to let us know where we're at with that?
Thanks, Erika. We don't have any further advice on pricing to share with you today. However, I can confirm that advice on pricing will be provided before the end of the year, ahead of more detailed advice by the end of March 2025. So we've heard from participant representatives that pricing needs to be provided as soon as possible to support older people to be able to consider their budgets, both in terms of the services they want to access and any associated contributions ahead of 1 July 2025. Stakeholders have also flagged potential impacts on investment and viability in the sector if price caps are set inappropriately, and the benefits of taking some time to gather live data to make sure caps are appropriate. We're looking really carefully at the nature of the advice to ensure that arrangements are implementable, support sector stability and viability, as well as continuity and availability of services to support home participants from 1 July 2025.
Thanks, Jasmine. Okay, so Michelle, I think this one will fall into your space. So it's just providers are reliant on ICT system operators to update their systems for supported home, but they haven't been given information on how supported home will work on the ICT side. How will they manage budgets and claims to Services Australia?
Sure, thanks, Erika, and thanks for the question. As alluded to earlier by Biravena in the presentation, we are anticipating that Services Australia will release the technical specifications in iterations from their software developer portal from December 2024. So Services Australia will also update existing guides on the aged care provider portal early next year with changes to the claiming process. This should provide the information providers need about changing to your claiming processes and what changes you need to make in your internal systems.
Thanks, Michelle. So there's one that's just popped in as a recent one, and I might take this one. So is where does the transition task force, as announced by Minister Wells, fit in with this process? Can providers contact the task force with concerns, or do these need to go through the department? So the task force has representation across a number of peak bodies, individual organisations, that kind of thing. So if you're a member of an organisation, if your representatives are on the task force, you could feed up through them. We're also running a supported home sector reference group regularly, where we've been going through engagement with the sector. So some people are providing feedback that way, but then of course direct feedback to the department as well. If we haven't included contact details that people can reach out to in the packs already, we can put that in the frequently asked questions and make sure we've got that pathway for information to flow in. All feedback is definitely welcome, and we will be passing it all up and using that feedback loop continuously to improve the information products we're developing. Okay, let's have a look for some other ones in the support at home space. This one sort of starts off with a bit of a comment. So providers are confident that they understand the steps required. However, the feedback that we're getting is really that people need more information, detailed information, especially on pricing and the amount of time it will take to be able to be ready when more providers get the information. So I think we've touched on a few things there already. So pricing we've already covered, and I think, Michelle, we covered a lot of this in your presentation, but is there anything else you wanted to add?
I think I just to draw it together to say that there is a provider transition checklist that we spoke about earlier that we'll be releasing before the end of the year, which will outline in detail the steps providers will need to take, the timeframes in which would be appropriate, and the supports that the department will provide to assist providers in that transition space. In addition to the release of the program manual, which we'll be doing in March of next year, post the release of specific guides and fact sheets that we will be putting out as well. So there'll be a program of release of information starting with the provider checklist shortly.
Thanks, Michelle. Just a recent one that's popped in. It's more of a general support at home program question. Can providers terminate support at home service agreements with participants who do not pay their contributions? And I guess maybe we'll just look at this from a general point of view on payment of contributions. Jazz, is there anything you want to comment on there?
I do know we're doing some work that'll sit obviously in the rules of the new app to look at things like security of tenure for clients, arrangements for contributions. It's nothing definitive we can share today, but we will make sure that we push that information out as part of our broader suite of information for providers and for older people.
Thank you. This is one for you, Rowena. Do AT retailers need to register as a supported home provider, or are you expecting them to link in with the home care package providers or supported home providers?
So we're not expecting AT retailers to take on the job of a supported home provider unless they would like to. And if they were a supported home provider, they would need to actually meet all of their requirements under the regulatory model. So we are expecting that they would actually link into the provider or the prescribers as they currently do.
Lots of questions. Just trying to bring some to the top, bouncing around a little bit. Okay. We've sort of touched on this a little bit already. It's just around gap payments. Will there be hardship arrangements for ATHM where clients can't make the personal contribution for their ATHM they need?
So under the support at home program, we are looking at hardship arrangements more broadly. So there won't be a hardship arrangement specifically to the ATHM scheme, but there will be hardship arrangements more broadly as in relation to the in relation to the support at home program itself. Jazz may be able to give some more information on that.
I'm going to give the exact same answer. We expect it will mirror arrangements that are currently in place supporting the existing home care package client cohort.
Okay. So this one is to do with the care management side of things. It just goes to a popular one. So under what circumstances will the department reconsider the 10% care management cap? Maybe we can talk about some of the groups that might be able to access extra care management support under the model with that one.
Yeah, really happy to do that and kind of provide an avenue for feedback if that's helpful. So as you've alluded to there will be some additional care management supplements for older Aboriginal and Torres Strait Islander people, people referred by care finders, people who are homeless or at risk of homelessness, care leavers and approved veterans. So we're mirroring essentially the arrangements for the existing veteran supplement for that last cohort. In terms of kind of avenues to provide thoughts on that 10% that's been referenced, the rules that sit under the new Aged Care Act, specifically, I think it's release 2A, consultation is still open and it does close tomorrow. So there's another avenue there for people to share views on a particular element of the program.
Okay, thank you. So Michelle, this one's been quite a popular one, but I think we've covered it a bit in the previous question, so happy just to refer to previous answers. So when will the final structures of the supported home program be issued? There's a lot of work providers need to complete, which they cannot be started until they know how the IT systems are being configured. I think we've covered that already, but let me know if there's anything else you wanted to add for that popular question there.
It is a popular question. Thanks, Erika. I think the only other thing I would say is to reiterate the release of the program manual, and ahead of that, fact sheet specifically focused on certain elements, and that will provide us with enough information or the information that they require to make the assessments of what they need within their business models. Happy to hear any other feedback or questions come through, and happy to respond following this webinar.
That's great. This is one just from the list. So it's been mentioned there'll be information for participants to ease their transition into support at home. Will this information be available in multiple languages? And if not, will we be able to use the translation service for this information? I think that's in your space, Michelle.
Yes, thanks, Erika. And yes, so in a word, we're working with our communications colleagues and subject matter experts in the department to ensure the communications we put out will have an option for translations and access to interpreters.
Thanks for that. And maybe I will just add as well, just having seen a few of the comms in development at the moment, we are also working on dedicated products for First Nations clients as well, to make sure we're providing information that's tailored to the different needs of different groups. So absolutely. Okay. Julia, there's quite a few questions here just generally on wait times and things like that. Did you just want to comment on those generally just to clear up a couple of those? Most of them are around, I guess, wait times in particular areas and how we might see that improving under single assessment.
Sure, thanks, Erika. Yeah, I can speak to that. So the government is aware we've got some long wait times in particular areas across the country, mostly for ACAT assessments. It's not everywhere, but it is in a few places and in some smaller areas for RAS assessments as well. Under single assessment systems, so part of what we have the opportunity to do here is to have more providers on the ground in every service area. And so in those 22 service areas that we see, there'll be more than one provider, so at least two, likely in most areas 3 or 4, who will share all of the assessments in that area. So both the home support assessments and the simple non-clinical assessments. What that will help us do is if we see a provider who's struggling to keep up with demand for whatever reason, and it could be because demand is peaky, it It could be because they're going through some changes in their workforce. It could be for other reasons as well. We've got more than one provider on the ground who may be able to step up and go, okay, we can take a little bit more at the moment. And so we are seeing this as a great opportunity to work on that wait time and to bring wait times across the assessment system back in line with community expectations and the service standard, which is no more than 10 to 40 days in a community setting. So the variation is based on the level of priority or urgency of a person's assessment. In a community-based setting, no one should be waiting more than 40 days for an aged care assessment. We're aware that in many areas it is longer than that, and in some areas it is a lot longer than that. So that is part of what we're aiming to do, and we'll be working with all of our providers over the coming months to gradually work on those wait times and get them back within the service standard.
Thanks, Julia. Now, this one's a multi-pronged one that's been sitting there for a little while. So I think the first part is about single assessment, and then there might be a question that's a bit more in the supported home policy space that relates to CHSP transition. So first part is how will the referrals to CHSP and supported home providers work under the single assessment model, and how will they determine if a client receives entry-level CHSP or higher-level supported home modifications? And then I'll read the last bit and we'll see if we need to come back to it, is what services will be in and out of scope for CHSP providers after 1 July 2025. So might start with the assessment side of that first, Julia.
Sorry, can you give that to me one more time, Erika? There was a
it's a multi-pronged one. Yep, definitely. So how will referrals to CHSP and supported home providers work in the single assessment model, and how do they determine whether a client gets those entry-level services or a supported home kind of package?
Yeah, okay. So similar to how assessors are today under using the IAT. So the IAT does it's one assessment tool for all types of care, and depending on how the older person answers some of those questions, so it may trigger more questions to open up that are indicating a greater level of complexity. So under supported home, so supported home will be replacing the home care packages program along with some other smaller programs. So the main change we'd be seeing there is that instead of referring to a home care package, would be supporting the assessor's referral would be to a supported home classification or Commonwealth Home Support Program. The IAT will help them make that decision, and there'll be there's a recommendation algorithm. So it might say this person's probably suitable for this program or this level of service under supported home. And then the assessor will have to consider that and look at all of the information they have in front of them and the conversation they've had with the older person and make a decision of what level of care that person does need. Yeah.
Okay, and then Jasmine, I might go to you for the last part of that question. Was are there any services excluded for CHSP from 1 July 2025 onwards? All good if we can't answer that one and have to take it on notice.
I think we can kind of point attendees. So there's a fact sheet we've recently put out. So that talks about the proposed changes to CHSP service list to align with supported home, and it highlights how we're making changes both because of trying to align with supported home, as I said, but also because of the introduction of the new Act. So I'd probably suggest people just had a look at that fact sheet. It'll give some further information to that point.
Okay, that's great. We'll pop that one in the frequently asked questions then and make sure we've got a link to that fact sheet. This one's quite a specific one. So on the supported home program generally, so the supported home handbook indicates that participants will be assigned an interim allocation of 60% of their classification budget if wait times exceed service expectations. Can you provide a bit more detail? Will this apply to grandfathered clients, and what are the expected timeframes?
Thanks, Erika. Good question. On the first part, if required, the arrangements will apply to both existing home care package or grandfathered clients as well as new supported home clients. And then under supported home, we're aiming for shorter average wait times from assessment to the point of receiving support with a target of 3 months from July 2027.
Okay, thank you. So Michelle and Biravena, this might be in your space. So what communications will the department issue to support providers to communicate changes to their clients?
Right, hand to you, Biravena.
Thanks, Michelle. So what we're actually looking at doing is developing a video for existing HCP participants to explain to them what it will look like when they do transition to support at home. So what it means for them in terms of their package, individual contributions, and explain the different scenarios for clients that were approved before 12th of September, clients that were approved after the 12th of September, and then clients that were approved and waiting to receive a package. So we're hoping that will address some of the questions that are being asked by existing HCP clients. With that also, within the checklist, we will also be providing resources to help providers to be able to answer questions to clients depending on the different scenarios. And there's a section within the checklist that talks to grandparenting, and they will provide some additional resources just to help providers have those conversations with their clients.
Okay, great, thank you. This one's more of a general one. So when will CHSP participants get better access to providers, as it's often difficult to get providers? Probably a broader program question, I think.
Sorry, that just cut out on my end, Erika.
Oh, sorry, Jazz. Can everyone hear me now? Yep, so when will CHSP participants get better access to providers? It's often very difficult to get providers.
It sounds a little bit like it might be about the arrangements for CHSP. If it is about whether or not CHSP existing clients can access support at home, they will be able to if their needs change. It will kind of mirror arrangements in terms of a reassessment that you might see for somebody whose needs increase between the CHSP program and the home care packages program. If it is about kind of funding to CHSP providers today, we'll probably need to pick that one up in our FAQs.
Okay, no problem. Michelle, I think this one's in your space. So will providers need to itemise the invoice submitted to Services Australia by the service for each client?
I can talk to that at a high level, I think, and we can provide more information in the FAQs, but it is anticipated that providers will need to provide more information, more detailed information in their invoices to Services Australia. The extent to what that looks like at the moment, I can't provide, but we will come back with more information on that.
That's great, thank you. Another one for you, Julia. Will providers need to know the difference between clinical and non-clinical assessments to help with referrals back for review to increase the client's access for more services?
So, if I understand the question correctly, I think what you're asking is, does the provider need to know what type of assessment the person might need? And the answer is no. So if you've got a client who isn't, you're not able to kind of provide the level of service that they are needing based on their current approvals, the reassessment process would be that they'd go back for reassessment, and the assessment organisation would triage them. And the triage process is about a clinically qualified assessor talking to them and having a short conversation, asking a set of predetermined questions to determine what level of assessment they do need. So that's a piece of expertise that sits with our assessment organisations, and there'll be that extra kind of piece of framework in the new system to help guide the assessment organisation to triage that person to the right person within their organisation, noting that in this new world, all organisations will have both clinical and non-clinical staff on hand.
Great, thank you. There's been a popular one sitting here for a little while as well, which is which providers have been approved to conduct the single assessment system. I think I'll just refer then, Julia, to your part of your presentation where you said you'll be announcing that shortly, and we're going to have that map available where people can check that out from next week, probably.
Yes, it'll either be Monday or we are working with the AusTender team to potentially release it tomorrow. So keep an eye out. Monday at the latest, because that's when we commence. but obviously those specificities remain kind of on lockdown until it has been announced officially by government.
Okay, great. And then where will the AT loan pool equipment sit? Is it with hospitals and community health teams, or will the loan pool also be accessible for discharge planning?
I can probably answer that one, Erika. So we are actually looking at a national assistive technology loan scheme being put in place, and we have been working with our jurisdictional colleagues across the country to see if we can leverage the existing loan programs that they have in place and to augment and expand those programs to cover the older people under support at home. They will be able to get access to assistive technology and or home modifications as they need them if they've been assessed as that being a need under the support at home process. So if they are a support at home participant, they will get access to the ATHM scheme and they will get that funding upfront at the beginning of their period after their assessment. It will also cover people who are coming in and out of hospital if they are a support at home participant. That's the other part of the question that I saw. So that will mean that, you know, people coming out of hospital will be able to get access to that equipment to assist them to get home as quickly as possible.
Okay, so we've only got a couple of minutes left. So there's one in here, Julia, around an appeals process for the IAT. I think it's probably just a more general question about, you know, the general assessment process rather than IAT itself. Is there any information we can point to on that?
So I'll speak at a very high level, and perhaps if there's more detail that could be provided, Katherine may. But I suppose at the moment, with aged care assessments for home care packages and residential care, we've got a reconsiderations process. So assessments under the Aged Care Act 1997. If you're not satisfied with the outcome of the assessment, in the first instance, you should talk to the assessment organisation and see if it can be resolved. But if it can't be resolved, there is that process of reconsiderations through the department that can be considered. From the commencement of the new Aged Care Act, that reconsideration process will also apply for assessments for CHSP, as it'll be coming under the Act. So I think the short answer is yes. There's a reconsiderations process. It exists today for all Act-covered assessments, and will be expanded into simple assessments or non-clinical assessments under the IAT in the future. But obviously, in the first instance, if those disputes or disagreements can be resolved, but in talking with your assessment organisation, that's usually the fastest way to resolve something. Yeah, but those avenues are there.
So I think we're approaching time, so we'll probably wrap up there. Like I mentioned before, a lot of great questions, a lot of interest. We will make sure we're going through all of those, capturing all of the details in some frequently asked questions. And then, of course, Biravena and Michelle have taken us through the forward schedule for engagement with the sector and our older people and their supporters into early next year. So we are looking forward to getting that information out to you soon, and want to thank everyone for their interest. I'll just see, there's a slide we can bring up at the end here for more information on support at home. So yep, we'll leave that up for you there. If you want to scan that, that's where you can hop in and see the most up-to-date information on what's going on with support at home, as well as links to any further webinars or published information. Thank you, everyone. That brings us to the end of our time together today. Thank you again for joining us.